All right, let's focus in then on Healthplix, which is basically a startup that offers in-house platform for doctors to help record the patient data digitally. They've recently raised close to $22 million in fresh investments. Let's connect then with Sandeep Gudibanda, who's the co-founder and chief executive of the company. Sandeep, thanks so much for taking time out. I just want to understand, given our rapidly expanding population, we have seen cases of many doctors not really finding enough time to assess adequately each patient. How is your platform, Healthplix, really solving this via the freemium model?
Sure. Yeah. First of all, thank you for this opportunity, and that's precisely the right question that one should ask on how one can digitize the healthcare platform, healthcare in India. Right? The key question is, like you mentioned, doctors would not have time to even treat the patients. They typically get about 3 to 4 minutes to treat each patient, and if you're taking away a significant amount of that time to do data entry, they're not going to adopt, right? So that's a reality. So Healthplix is not the first EMR that has come to the country, and it's after Healthplix, there have been hundreds of other EMRs that have come as well, right? But what Healthplix has done well is to say that we're building this software for doctor, right? We're not building it for an administrator. We're not building it for a policyholder, right? So for doctors, it takes less than 30 seconds to write a prescription. So it can do that because it's very intelligent, understands from the doctor, learns from his own practice, what brands is going to write, what complaints is going to write, etc., etc. So by the time he's written about 25 prescriptions, it takes less than 30 seconds, right? He does about 8 characters, get 500 character worth prescription, right? So you need to understand this piece well to get doctors to digitize, right? I think that's precisely what Healthplix has done. And we today, about 3% of entire doctor fraternity uses Healthplix. And there's a lot of white space, as you understand, right? Our goal is to get to 100% of that population.
Okay, fair enough. So just walk us through then how much you've raised so far. The latest round is $22 million. Who are some of the investors that have participated, and what is the total fundraise right now? Any details on what the valuation could potentially be for Healthplix?
Yeah, we've raised about $22 million. SIG and Avatar are the lead investors for us. Every single existing investor has participated in us, right? So 20 million in equity, 2 million in debt. That's the overall construct of fundraise for us, right? I mean, as India is going through a digital revolution in healthcare, some of these investors understand the fact that Healthplix is a doctor-first firm. We realize that anything that needs to happen in Indian healthcare needs to happen through a doctor. So both SIG and Avatar understand that, and then that's one of the reasons why we sort of zeroed in on them, right? I mean, SIG is big on unit economics. They've seen us for a long time. Avatar is big on SaaS, so it's not like a speed dating thing, right? Anymore, investments. These firms have been tracking us. They've seen us how we respond to various challenges, whether it is global, local, internal, external, etc. Right? So that's how we ended up raising from this. It's been a phenomenal journey. Of course, funding winter is here, raising funds with almost like 2x the valuation that we had done last time. I think it's kudos to the team, right? Thank you.
Yeah, and despite that funding winter, you have managed to raise funds at a time like this. So I know that AI is really at the forefront of what you guys do in terms of aiding technology, providing real digital solutions. How exactly does it work? Because it's helping to write the doctor's prescriptions, even search for appropriate medicines and diagnosis. So you're using AI to do this?
Yes, absolutely, right? So, see, I mean, you look at the vision of Healthplix, right? So we're not just there to digitize healthcare, right? So we're there. Healthplix exists today because we want a better health outcomes at a population level, right? Which means it's not just about making it easy for doctors to write the prescription, but helping doctors to tap into his own wisdom to think of the right treatment for the right patient at that time, right? So that's when we would have done our job. I think Healthplix has come a long way. Today, about 2.5 crore unique patients have been treated in Healthplix, and every single consultation is an opportunity for us to add, drive health outcomes. How do we do it? We do this at 4 levels, right? We sort of leverage AI to understand doctor specialty, his own preferences. Every doctor's practice preference will be different. We understand patient's disease. We understand the stage of the disease, right? So we go 4 layers to help doctors, sort of one, as I said, understand what has happened in the last, couple of years, couple of visits for the patients, understand what treatment worked for him, what did not work, so that he can pick the right one right now. So just a longitudinal view of the patient, disease progression itself will help him do that, right? So on all of these things, we leverage collective intelligence, we leverage AI to help doctor for that one consultation, right? So, like I said, right treatment for the right patient. It could be alerts based on the risk profile of the patient. This patient is high risk for thyroid. This patient is high risk for liver. Or it could be things like in this geographical area, there's a lot of dengue cases coming up, or there's a lot of upper respiratory tract infection coming up, right? So for all of these things, as you can see, with having treated about 2.5 crore unique patients, having done about 70 million unique consultations, having, we do about 100,000 consultations on a daily basis. That's a lot of data that we can leverage to help doctor on that one consultation, right? When he has 2 minutes, 3 minutes to treat the patient, we want to be the assistant that doctor can rely on, right? So we do that, and there's a lot more for us to achieve as well. But we're happy with what we're currently doing.
What are the current revenues that you enjoy, the FY22 revenues? How have they grown over the last year? And what is the projection going down the line?
Sure. So, I mean, as a firm, we have been fundamentally looking at, getting the fundamentals right? So, first couple of years, we just built out the product. It meant adopting, getting doctors to adopt a digital EMR meant everything for us, right? So, when you think about revenues at that point of time, we just went out to get doctors, right? So that's a couple of years of journey. But last year, 2020 onwards, we've been monetizing this. So our revenue multiples have been about 3x last year to now, because and gross margins are very high, right? 85% sort of gross margin level. So this year to next year, we're thinking about growing that to about 3.5 to 4x. So we have ambitious goals. But I mean, given the track record, given that doctors are increasingly adopting technology, we are super confident that we will get to those numbers.
All right, super confident that you can continue to grow. So what exactly is it in terms of how it works? Because you're helping doctors really create a 360-degree medical profile of their patients. So how exactly is this helpful in, treating a lot of diseases? How does it work in terms of the patients, helping patients to really understand what has been prescribed, and given that you're using AI, does that, just relegate it to just English as a language?
Yeah, absolutely not, right? I mean, doctors write in English when it is getting printed out or when it is getting sent out to a patient. It can be converted into 14 different languages. A lot of structured things which patients need to understand in their own language, where compliance will go up, etc. Roughly about 60% of our all consultations, while doctors would have written in English, when they're printing it out or when they're sending it out, it is in their vernacular language, right? So the doctors who use Healthplix on a daily basis and on 12 different languages, right? So that's one of the reasons why Healthplix adoption has been very, very key. So that's on the language bit, but you did touch upon how are we increasing, how does it work, right? So we believe doctors are heroes, right? I mean, they do so much for all of us. So I keep telling all my employees that they're like superheroes, Batman, right? At Healthplix, we want to be Robin for that Batman, right? I mean, we want to help him tap into his own wisdom, right? A patient is sitting right in front of him, just showcasing the disease progression, right? I mean, like for example, diabetes, there are about 512 different ways in which it is being treated on Healthplix platform. And if it doesn't work for that persona, doctor needs to change the treatment, right? Now, he may have employed multiple treatment regimens in the past. Just showcasing what worked for that patient, what didn't at that moment, would help doctors to pick the right one. Now, let's say there's a patient whose, diagnosis has been made as chronic kidney disease, and in that there is a stage, let's say CKD stage 3. For that stage and for that disease, what doctors should look at, I mean, a bare minimum is something that shows up on Healthplix platform, so that even if he's spending just 5 seconds looking at the glancing of the screen, he should not miss out on the most basic things. So that's how we keep thinking, right? How do we give information back to doctor that will allow him to sort of bring out the right knowledge that he already has at that moment, right? So that's the way we sort of leverage data, leverage AI, leverage doctors' time on the platform, etc., to improve health outcomes.
Wanted to understand what your funds will be utilized towards?
I think the one that we're talking about, right? So we want to be serving to the vision of the firm, right, which is to improve health outcomes. So hence there are a lot of clinical decision support algorithms that we want to build out for many diseases. That's going to be the first thing, which means that we need to double down on the engineering, effort, number of people that we need. We're going to double down on number of doctors that we can onboard onto the platform. So while we're not looking at anything outside India, but we will explore, because as I said, 3% of entire Indian doctor fraternity uses Healthplix. The goal is to get to 100%. That's where we will be allocating the funds to.
There have been a number of business models that have been very close to this. There are already a lot of companies that adopt in this, that are working in this space. You know, the EMR platforms in India that we've seen, electronic medical record platforms that really claim to have doctors help treating their patients a lot more efficiently. So what is the standout factor? How do you plan to really take on the competition and stand out?
Yeah, I think competition is good. Like many entrepreneurs say that competition is good. That means there's a real opportunity here. Roughly 70-80% of all the doctors who use any EMR use Healthplix, which means we are the leader in that space, right? And significant at that. But are we super big? As I said, only 3% of doctor fraternity users. So there is so much more white space. So there is room for many players, right? But I've seen many entrepreneurs who come in and then say, we will change this in healthcare with the right mindset, right? But getting healthcare digitized is not an easy job, especially now with the funding winter happening. We see so many entrepreneurs struggling. So which means there's a consolidation opportunity that is coming up. So we will be, sort of mindful of what opportunities come up. So we are working on a couple of them right now. But we will be conservative at it, right? It needs to come at the right price. The expectations, of course, have gone down. But I think competition is really becoming a consolidation opportunity, given the market conditions now, to be very honest.
Okay, and how many doctors are you currently servicing? What specialties do you have? And how many patients have been treated using the platform so far? What's the expansion plan on this front?
Sure. So when I say a doctor is a user for us, he has to be using it for 100% of his patients, whether he's doing a teleconsultation or in-clinic consultation in his own clinic, right? So that's our user. If it's just listed on a marketplace, etc., that doesn't become our user, right? So our users spend on average 4 hours on a daily basis per doctor per day, which means the traction is very high. There are about 11,000 such doctors who use Healthplix on a daily basis. Through them, we treat about 110,000 unique patients, unique consultations on a daily basis. So far, we have treated about 2.5 million unique patients on the Healthplix platform, and we have done about 70 million unique consults. Coming to the specialty, we are big in super specialty, which means MBBS, MD, and DM, right? People who are super specialized are the likely users of Healthplix because they are the ones who are a lot more clinical. Also chronic diseases is where you need to arrest the disease pretty early, which means early intervention is important. So for those reasons, we've chosen those specialties. But of course, in the last couple of years, we've expanded to acute and episodic specialties as well.
All right, Sandeep, we'll let you go on that note. Appreciate your time. Thanks so much for joining us on Startup Central. Let's move right on then. And the government, we understand, is considering restricting the sale of medicines through online pharmacies, but could allow the use of digital prescriptions under the E-Pharmacy regulations that are currently being drafted. Let's understand what exactly is being put into place. My colleague Sumita Karir joins in with that perspective. Sumita.
Online pharmacies might have to swallow a bitter pill, and the reason is that the All India Organization Organization of Chemists and Druggists are up in arms against online pharmacy. Or not just that, the government is also thinking of tightening regulations in the sector to control businesses in the ecosystem. After all, it's all set to reach $130 billion by 2030. So let's understand what the big fuss over these regulations is. Essentially, the issue is over proper regulation of the industry. Now, at present, the industry is governed by the Drug and Cosmetics Act 1940, which regulates the import, manufacturing and distribution of drugs in India. The technology aspect is covered under the IT Act 2000, but complainants have been claiming that e-pharmacies are engaging in malpractices, pointing to the fact that these laws may be deficient. Now, some of the malpractices that they have quoted include, number one, predatory pricing because of deep discounting by online pharmacies, concerns of impact of quality of drugs, concerns over self-medication, data misuse, data collection and misuse, and of course it violates the privacy of individuals. However, the biggest concern is over the sale of prohibited drugs, drugs that are not allowed for retail sale without proper documentation or prescriptions. And this is the key bone of contention because it could lead to an impact on the health of patients. So the Ministry of Chemicals and Fertilizers has drafted some regulations. But then this issue is not new. Let's go back a bit. In February this year, the Health Ministry pulled up at least 20 top Indian online pharma companies, including Tata 1mg, Flipkart, Apollo, PharmEasy, NetMeds, amongst others. The Drug Controller General of India, or DGCI, sent show cause notices to some of these pharmacies. In fact, the trigger was a warning by the All India Organization of Chemists and Druggists that they would launch a countrywide movement if the government failed to take cognizance of their concerns that are listed above. Now, recently, a parliamentary panel too called for due diligence measures, guidelines and mandatory registration. Now, all of this needs to be seen in light of the fact that online pharmacies stepped up during the COVID-19 pandemic and delivered medicines within 24 hours, which proved to be a watershed moment for the industry. The e-pharmacy market is valued at $344.8 million in 2021 and now is all set to reach $130 billion by 2030 amidst an increase in medical spending, increasing investments and consolidation, and of course, growing internet penetration.
Let's also hear out what some experts had to say regarding the e-pharmacy regulations.
I'm not aware about what the concerns are because the government has not sort of engaged with us yet. We have written for a meeting, for an appointment. Hopefully, we should be able to meet them and understand the concerns and hopefully address them as well. The typical concern is today the kind of model we have falls under multiple ministries from a governance and regulations point of view. The platform, because it falls under the IT ministry, they are sort of governed by the IT Act.
The government could not make the e-pharmacy e-prescription. As a result, it is stopped. And now we find that mostly these people are collecting the health data, which is they are violating the data security, data privacy, and data integrity of the citizens, which they are not supposed to do. Second thing, we have pleaded the government. Now the Honorable Prime Minister brought the National Digital Health Mission, which is covering Ayushman Bharat.
You're not going to have one law which says for e-pharmacies, this will be the story. It just seems too difficult to do. You can't keep on tweaking it as technology improves. So it's just not practical. We haven't done it to Big Basket, Amazon, none of the others. So, e-commerce, if there are regulations, they will apply. The IT ministry will have jurisdiction over it. In this case, the Department of Pharmaceuticals will deal with the actual sale of it. How it is sold, whether it is sold online, on WhatsApp, it's a bit of too much detail. Tomorrow, if you have something beyond WhatsApp and online, then what happens? So I wouldn't go down that path. The legality of it is fairly well understood. I think you have so many of these startups who've taken good legal advice, including discussions with government. And if it was illegal per se, they wouldn't be operating in this country.
All right, moving on then, the Apple chief executive Tim Cook has gone ahead and said that the US tech major is excited to be building their over 25-year history in India, where the company is opening their first 2 retail stores this week. Apple will be opening their first company-owned retail store on the 18th of April, that is tomorrow, and the second one is going to be on the 20th of April in New Delhi. Cook is also widely expected to come to India for the inauguration of the stores this week. He may be meeting some of the top policymakers, including the Prime Minister Narendra Modi, and appraise them of the company's plans to deepen the iPhone's manufacturing in India. In fact, my colleague Aishwarya Patil then has gone ahead and actually visited the store in Mumbai. It's supposed to be 22,000 square feet, and it is the flagship store at Reliance Industries Geo World Drive. Let's find out and take a sneak peek as to what exactly it looks like. Aishwarya.
Inside the Apple store, you can see a floor-to-ceiling facade here on the side. You can also see a lot of plantation. Apple has emphasized on this store being energy efficient is what they're saying. Now let's talk about what's in the avenues here. On the left, onto my left, you can see all the models of Apple iPhones lined up, right from the Pro models to the basic models. And on the right, you can see the Apple iPads and Apple Pencils kept here for demonstration. And tomorrow, when the store opens up for the public at 11 a.m., they can experience all of these products firsthand. Let's take you towards the other side. Here you can see the MacBook Pros all lined up for demonstration, as well as the MacBook systems that you can see here. And onto the back, as you can see, is the wall which actually displays the AirPods, the iWatches, as well as all of the MagSafe accessories which have been launched by Apple. And on the top floor, we also have the gaming arcade, as well as other premium Apple accessories.
Names, which are Paytm and Zomato. Paytm, of course, we have got good timing, so we are up some 20-25%. Zomato, we were up and then it went back, so now we are zero. But both these are big brands, big survivors. And although, like for example, you read recently that Reliance is coming into cosmetics, or trying to compete with Nykaa and stuff like that. Nobody is going to announce, new person is going to say that we are going into food delivery or going into even payment business so easily. And therefore, these guys are now in a place where previously there may have been 20 guys, and now they are, in the case of food delivery, down to 2. And there is no way a third guy can come in. And in this, one of the 2 is unlisted. And if they compete too hard and think that by getting a few more market share points here or there, they can have a hope of getting listed, that also does not work unless Zomato does well. So I think that the steady state solution will be that Swiggy will back off, let the Zomato win a little bit in the market, so that some years or months later, maybe 1 year later, it can hope to go public. Otherwise, it can keep fighting without having ability to get listed, because the market will not accept a second name in exactly the same business with nearly exactly the same market share.
A no makeup look, a stunning party makeover, or a skincare routine you can't refuse. Beauty and personal care brands are leveraging all this and more to get you hooked on to their products. And with the likes of Nykaa, SS Beauty and Sephora already competing for a piece of the pie in this space, with the launch of Tira, the competition is about to get tougher.
Well,
While most multi-brand beauty and personal care stores give you a choice to pick from a range of products including skincare, cosmetics, perfumes and hair care products, Reliance Retail's Tira houses some unique experiences. A vending machine with samples to choose from, an option to give a personalized touch with the etching machine, although a bit gimmicky, and a fragrance finder based on the notes you pick. This machine gives you options of perfumes that you can choose from. While Tira's focus may be to enhance customer experience, there is still a long way to go before it finds its feet. And India's beauty and personal care space has room to grow to almost 2 trillion. Rival brands like Sephora, SS Beauty and Nykaa, although tight-lipped about their market share, have already built their network. Shoppers Stop has a network of over 90 stores across India, but apart from the shop-in-shops, it plans to add 10 to 15 Shoppers Stop beauty stores each year with a strong focus on exclusive distribution business. Sephora, on the other hand, has a network of 26 stores across India and has shown a low single-digit profitability in Q3 FY23. Recently listed Nykaa has a network of 135 stores across 56 cities in India. Experts believe for beauty brands in India there is more room to grow and opportunity to grab a bigger piece of the pie. But only time will tell which of them will be the showstopper.
And on that note, then, it's timed out right here on this edition of the show. Please do connect with us. Thanks so much for watching.